This is Vanessa McElroy, and this is the final video in my series, and this one's going to cover chest and lungs and heart and blood vessels. I have my patient here already, Mr. McElroy. He's on the table, ready to be examined. We're going to start with chest and lungs, and I may have to move the camera around a little at a time, but first thing I'm going to do is inspect, and chest looks clean. His respiratory rate, and he's not using any accessory muscles. His skin color is good. He's equal bilaterally. Everything appears normal. There's not any protrusions or masses or anything in his chest area. Then I'm going to evaluate, like I said, his respiratory rate and rhythm, the size and shape of his chest, and it appears to be normal. He doesn't have any, look like he has any barrel chest or anything like that. Chest movement is symmetrical. No prominence of ribs anywhere that I can see. Then I'm going to have him sit up and turn, if you don't carry your legs that way, and your back to the camera. It's your best pose, isn't it? And I'm going to measure thoracic expansion on him by encircling my hands around his back right here. And then if you'll take a deep breath in and let it out. Deep breath in and let it out. Okay, and that seemed to be equal bilaterally without any difference. The other thing I'm going to do is check for tactile fremitus, so I'm going to have him say, repeat 99 about 4 times.
99, 99, 99, 99.
Okay, and that seemed okay. There wasn't any difference in that. Or then, if I could have you spin back around just a little bit. Actually, stay where you're at. Now come around there so you don't have to turn again. And I'm examining his trachea, and it appears to be midline, no deviation, no masses or protrusions. And then, since I left him sitting like that, we can go on with the rest of our assessment and do the percussion to his back. And since he's sitting like this, I'll go ahead and do the back part first. If you'll just keep your head about like you got it and bend your arms across your chest. There you go. And I'm going to percuss across the back. Trying to note any differences side to side especially. If you could hold your arms over your head and do the same thing on each side. And then, do you think you could flip around this way where I could get to the front of your chest? And just sit straight up like that. Okay. Then the next thing I can do is check his diaphragmatic excursion, and to be able to get to the camera I have to have him flip around again. Sorry. And I need tape to do this, or a measuring pin or something. I'm going to use tape. And okay, if you'll take a deep breath and hold it. Okay, you can breathe. Now take 2 deep breaths in and out, and on the last one, push all the air out you can and hold it. Let me let you breathe for a minute. Can't find it. Let me do the in breath again. I think I might have done it wrong. Deep breath in. Right there. Okay, you can breathe. Now, deep breath in, let it all out and hold it. Okay. Right there. Then I would also do the same thing on the other side. Look for whether it's different on one side to the other, although the right probably would be a little bit higher because of the way the liver sits in the rib cage. And as long as this is somewhere between 3 and 5 centimeters, then that's normal, and it looks like his is. Then I'm going to go ahead and listen to breath sounds. Since he's sitting this way, I'll start with the back. If you'll cross your arms again, just there you go. Just take slow, deep breaths in and out. Alright, I'm going to go around this way. And if you'll sit with your shoulders back just a little bit, stretched up, there you go. And I'm not going to make him turn for this, but okay. And then if you'll raise your arms up over your head, take slow, deep breath. Okay. And then I would do the other side that way too. I don't hear any abnormal breath sounds, no adventitious breath sounds, no rhonchi, wheezing, anything like that. Everything sounds normal, equal bilaterally. Doesn't seem to be diminished in the bases or anything like that. Then I want to check voice resonance. And the way I'm going to do that is have him say, first of all, say 99 every time my stethoscope touches his back, and I'm going to check that to see if he has any bronchophony, which is when the 99 sound is amplified, and that could be from some kind of a fusion or consolidation in his lungs.
99, 99, 99, 99, 99, 99.
Okay, that sounds good. And then I'm going to let him say E to see if that changes and sounds like an A, which is for egophony, to test for egophony. And it should come through just as an E. When I hear it, I should hear a pretty clear E.
E, 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 E.
And I do, okay. Then I want to have him whisper. Okay. Same thing with that. I'm just looking to see if it resonates or gets any louder. And the other thing I want to do is let him cough. Okay, we'll do one more. Okay, and I don't hear, it doesn't sound loose, doesn't sound like anything that seems to be a problem. I think that's it. The only thing I didn't do for that is measure his Anterior, posterior versus transverse.